Hi guys, I'm Jarek Naylor and this is Partially Impartial. We're officially into the next leg of this global pandemic. We're seeing cases spike in the majority of states here in the United States. The economy has been holding up with help from the Fed and with government stimulus, and no one really knows how all this is going to turn out. But I think we can all agree that the world will look substantially different going forward from here. And that being said, I'm joined tonight by CJ, so thanks for chatting with me tonight.
Yeah, of course, man. It's been a while since it's just been a one-on-one chat with me and you.
Yeah, that's true. It has. I'm sure it'll be a good one. So, looking at the cases here, we've got a couple articles we want to touch on. There hasn't been too much really big news coming out since our last show when we did the full coronavirus breakdown. It's just mostly been more of the same, more of a continuation of this quote unquote second wave or resurgence of the virus here in the US. And so we will kind of just share the more things that have been coming out about that. So it is a holiday right now, holiday weekend. So a lot of the numbers coming out right now are going to be a little bit behind. We're expecting to break 60,000 cases per day at some point next week in the U.S. and probably around 220,000 cases per day globally we'll start seeing, and that could sky's the limit on that really. So we have been breaking records before Friday. On Thursday, I think was the last day before the holiday where we had like a full reporting day. We got around 55,000. I actually don't have the numbers right in front of me, but it was somewhere around 55,000. And before that, we were getting around 52,000. We've had several days over 50,000 new cases here in the U.S., which is pretty significant. We were getting around 30,000. We were peaking around 30,000 at the peak of the first wave. So now that we're up to 50,000, that's a really significant increase here. So looking at some of the charts here, me and CJ were talking about these a little bit, and I haven't looked at the global chart very recently, and man, it really tells an interesting story. We've back, in the first wave of this, we were staying under 100,000 cases per day, and that's just gone straight up ever since about May 20th. It's just gone from 100,000 to over 200,000 a day now. So that's really significant happening there. It really shows that not only is the virus getting a good, strong foothold throughout the whole world, which is something that takes a long time for it to just saturate so much, but also that now many countries are starting to get a better hold on their testing, like in India and Brazil. So, and then looking at the U.S. numbers here, the graph's telling a pretty similar thing. I know CJ was telling me about the active cases before the show. You want to tell us a little bit about that, CJ?
Well, yeah, I mean, it's when it comes down to it, I mean, just the current active cases that we have right now in the United States is a little swerved, and I say that just because of the way that we're judging how cases are considered recovered, because there's so many people out there that are still sick, or are still potentially out of their lung capacity, or they're not not 100%, and just because they haven't had a fever for 3 days, or are considered cured or recovered, whereas I believe that the number of active cases is a lot larger than what they're putting out to be, and just because they're calling so many people recovered that we really have no idea.
Yeah, so looking at the chart here, we pretty much started going up, mid-March, and then we peaked around 1.1 million active cases, and we really hung out there for quite a while. And I remember seeing headlines coming out, basically Wall Street being excited about the fact that we started seeing active cases starting to go down, and the headlines were saying like, "Oh, we've seen the peak infection now," because obviously the most important number is how many active cases do you have in the United States at any given time, not necessarily total infections. Active cases kind of tells you a more complete story of what's going on at a specific moment. And then we dipped down to about 1,050,000, and then ever since the beginning of June, the active cases has climbed up faster and faster. So that means that we're getting more people sick than are recovering. So we're getting more and more of these cases that are actually active and infectious in the US here. And now we are up to over 1.5 million people currently have it. And like CJ was saying, they're marking people off. I'm not sure if they do this in every state. I think it might be different state by state. But here in Utah, they're marking people as recovered, basically if they haven't died in 3 weeks.
It's actually a World Health Organization. That's what their recommendation is after that allotted time that you are considered recovered.
I see. Yeah, it's probably the WHO recommendation, and maybe certain places are doing it a little differently. But
Yeah.
yeah, I saw in another state they were doing it a little differently. I can't recall exactly what it was, but yeah. So it sounds like a majority of places are using that 3 week rule. And we'll touch a little bit. CJ's got an article about why that kind of doesn't paint the most accurate picture, because there's a lot of people that are experiencing symptoms well beyond 3 weeks, and even experiencing symptoms that uh, they're still experiencing them even after they've had a negative or several negatives. So that really starts to bring up questions about, is it permanent damage, or it's so early on in this that we can't really say for sure if it's going to be a permanent thing or not.
And it's one of those things too. It's it's been implanted in our brains that it's supposed to be a death or survive, like die or survive. Then like that's what this virus is. You get it and you die, or you survive. And it's like, no, there's like, just like with any other virus or any other sickness, you get it, and there's going to be some long-term effects. It's not just you get it and you could die. You get it and you could have to be on oxygen for the rest of your life. You get it and you could you know need a walker for the rest of your life, or potentially have years of recovery ahead of you. Like, it's not just a hit or miss type deal. And that's one of those things that I think we're missing out on. And that was the whole idea of when we started reopening, just like when we looked at those numbers, and just around the beginning of June, as we started to reopen, we started seeing our daily cases that were the highs. We started seeing those like basically double. I mean, we've seen up to 57,000 cases in one day, and like as you were saying, we're gonna hit 60, and it's not gonna stop there. Especially with the holiday and whatnot. I mean, we have the potential in the U.S. to start seeing very, very high numbers within the next 2 weeks, and I'm all for celebrating America and freedom and whatnot, but I seen a hell of a lot of fireworks last night, and I know that they weren't all in one place. So, I mean, we'll just have to see how it all plays out. And I mean, I hope that people were smart about it, and I hope that they had some hand sanitizer and some masks on hand. And I mean, we'll just have to see where it goes. I mean, it's obviously going straight up. So, I mean, my guess is that it's going to go a lot higher, but yeah.
Yeah, it's so I actually, my roommate, one of my roommates started showing symptoms, and then shortly after, another one of my roommates started showing symptoms. So I got fairly worried, and so one of them got tested, but we didn't get the test results back during the fireworks show last night. And even though because I'm obviously taking it pretty serious, and people around me are somewhat taking it serious. And even though we knew that she could have it, and we haven't had the test results back, it was still really relaxed on, like, no one was particularly trying to stay away from her or away, to try to avoid gathering in a large group, we probably had like 15 people yesterday in the house, and the one who potentially could have had it, she's a she's known for being a pretty loud person, and so I was just like picturing all these virus particles like spewing out as she was laughing and shouting and stuff. I was just like, just the social pressure of the whole thing, like it would be so weird for me to stand up and be like, no, Jaden, you need to go upstairs. You're not going to join us tonight. It just would feel so weird. So I can kind of testify to the fact that, people are probably not doing enough to try and stop this right now, because we haven't really gained a full respect for it yet. If there had been if somebody, that all of us knew that had a serious condition, or, it was like a direct experience thing, then I would have no problem standing up and saying that. But because we're still kind of, uh, haven't really seen the worst of it here in Utah, I feel like a lot of people are probably experiencing that similar social pressure to just go on normal. No one wants to be the one that stands out. But yeah, I agree with what you said, that we're kind of being trained, or something like that, to see it as recovered or deaths, and that it really misses a lot of the picture, because we are getting much better at making sure that people don't die, but it is taking a huge amount of resources at our hospitals, and if those get overwhelmed, then we're not going to be able to do these better treatment plans that we have now. Like, one I heard was, instead of doing the ventilator, which they're hardly using anymore because it can actually be really bad to basically force oxygen into your damaged lungs, they're taking people, hooking hoses up to them and pumping their blood out, and oxygenating it in a machine outside of their body, and then pumping it back in. And apparently they're having quite a bit of success with that. But that sounds like a pretty intense thing to do. Like, you got to have doctors there to do that. You can't just do that if you don't have the room and the staff and the knowledge available to do that. So, I think one thing that people should pay way more attention to is the hospitalizations. And I actually have an article here. Maybe we'll start with this one that actually goes into detail about the hospitals in Houston, which I think are getting hit probably the hardest out of anywhere in the country right now. So I'll just read off some of this article, and you guys can see for yourself. So uh, this was published July 1st, so a couple days ago. Let's see. It says, Houston. At Lyndon B. Johnson Hospital on Sunday, the medical staff ran out of both space for new coronavirus patients and the key drug needed to treat them. With no open beds at the public hospital, a dozen COVID-19 patients who were in need of intensive care were stuck in the emergency room, awaiting transfers to other Houston area hospitals, according to a note sent to the staff and shared with reporters. Also, I heard from somebody I know that they had been talking to somebody, one of the doctors that are involved with this, and she said that some people are being told to wait in their car, and there's been some situations where people died in their car waiting to get help. So we're already to that point where we're starting to see some negative impacts of how overwhelmed the hospitals are. But continuing here, a day later, the top physician executive at the Houston Methodist Hospital system wrote to staff members warning that its coronavirus caseload was surging. It has become necessary to consider delaying more surgical services to create further capacity for COVID-19 patients. So that's something we did fairly early on. They kind of just did it across the board. They canceled all, what's the word for it? Non-important. Yeah, those surgeries.
Selective surgeries. It was just like I actually, when I got my gallbladder out, it was the perfect time. Like it was right when like we started to like cut back on like all the all the strict protocol at the hospitals, and I was able to have my girlfriend come with me, and she was able to wait in the waiting room and stuff like that. Whereas before that you couldn't do that, and even now that's where we're back at.
Yeah, definitely in Texas they're considering that. I think here in Utah they're probably still allowing that, but I know we're starting to see some problems here in Utah's hospitals as well. But continuing, it says Dr. Robert Phillips said in a note an abrupt turn from 3 days earlier when the hospital system sent a note to thousands of patients inviting them to keep their surgical appointments. So just a few days earlier, they sent out a thing to make everyone feel better, inviting them to keep all their elective surgeries, and then now all of a sudden they're changing. So that shows you how quickly just a few bad days, a few days where you get more patients than you expect, and then you put that in your models, and you're like, wow, if this continues, we're going to have issues like 1 week from now. And you want to make these decisions, these big decisions. You want to make them before everything's overwhelmed, because of obviously because of the lag. You could, so let's say, lock down the whole state of Texas again right now, and we could still see a really rough month ahead, because of how long it takes for this to spread. I think it actually talks about that a little later in this article here. It says at the University of Texas MD Anderson Cancer Center, staff members were alerted recently that the hospital would soon begin taking in cancer patients with COVID 19 from the city's overburdened public hospital system, a highly unusual move for the specialty hospital. So it sounds like they're already kind of implementing these overflow measures. These internal messages highlight the growing strain that the coronavirus crisis is putting on hospital systems in the Houston region, where the number of patients hospitalized with COVID 19 has nearly quadrupled since Memorial Day. As of Tuesday, more than 3,000 people were hospitalized for the coronavirus in the region, including nearly 800 in the ICU. To tell you the truth, what worries me is not this week. We're still kind of handling it, said Roberta Schwartz, Houston Methodist Chief Innovation Officer, who has been helping lead the system's effort to expand beds for COVID 19 patients. I'm really worried about next week. What's happening in Houston draws eerie parallels to New York City in late March, when every day brought steep increases in the number of patients seeking care at the overburdened hospitals, though so far with fewer deaths. But as coronavirus cases surge in Texas, state officials have not re-implemented the same lockdown measures that experts say helped bring New York's outbreak under control, raising concern among public health officials that Houston won't be able to flatten the curve. The time to act to the time to act and time to be alarmed is not when you've hit capacity, but it's much earlier, when you start to see hospitalizations increase at a very fast rate, said Lauren Ansel Myers, a professor of integrative biology who leads the University of Texas at Austin COVID 19 Modeling Consortium. It's definitely time to take some kind of action. It's time to be alarmed. So yeah, that when we first started seeing things like this in New York, they were much less hesitant to just shut things down. And even after they shut things down fully, it was still quite a while until numbers started going down, and until we get to the point where we're at now, where they're not seeing that many deaths.
Yeah, and I mean, that's the thing is, even though we're not seeing as many deaths, our serious critical is going up daily. We're already
What's it at now? I haven't looked at that for a minute.
it's at 16,000 now.
Oh, okay. So yeah, we were at 16,000 for a while, and then it went down to 15,000. But I guess we're back up to 16,000 now.
Yeah, and I mean, that's one of those things that I feel like it's just alarming with the fact that we have double pretty much any other country.
Yeah, true. Yeah, we definitely have.
Yeah, I feel like the closest to us would be India,
Oh yeah, huh.
and India's got
Yeah, we definitely have more room for serious and critical patients, and that's honestly, that serious and critical number is not one that I really trust that much to fully be kept up on. Like, I know Florida is doing a really bad job at reporting what's going on in their hospitals, and I'm sure all these other countries, Brazil and India and Russia, they're probably not reporting like every single patient that's in the ICU bed as well.
um want to see something alarming?
What?
Look at the total tests in Brazil and then look at the total cases.
So they've done 3 million compared to our 37 million, and they're they have more than half the case. Holy shit. So literally 50% of all the tests done in Brazil come back positive.
And what's really that's extremely alarming. And I mean, I've personally, I mean, I don't want to stereotype anybody, but I've personally seen Brazilians come in and get pizza at our pizza place, and everybody there wearing a mask, and there's signs on the door that say wear a mask, and they were the only ones not wearing a mask, and they brought the whole family. So it's just like, I don't know if that's just maybe what they're preaching over there, or I don't know. Like, that's just really alarming about the amount of tests and how positive that is. Like, that means, like, Jesus, you're looking at, like, 60 to 70% of the country has it.
Well, I don't. It's probably hasn't quite spread through that much, but yeah, it is. That's really strange that we would see that many positives. It definitely does show that far more people have it than what's officially been reported. If they're seeing that high, and probably more deaths as well. They probably, because we ran into that issue here in the U.S. where we just simply didn't have the testing capacity to test all these bodies that were piling up that could potentially have had it. And so I'm guarantee they're having that type of problem in Brazil as well. I know they've have been digging mass graves. They've been doing all sorts of things to control the dead bodies as they're flowing in. That's now that you pointed that out, I'm gonna look into Brazil more. I'm really curious to what they're doing to try and fight this, if anything, or if they're just fully letting it run rampant. But it's probably going to have a hard time getting really good data.
Yeah, and I mean, it's just kind of like, I feel like, I don't know, like Brazil's been like really kind of all over the place the last few years too. Like I swear that didn't they just like decriminalize all drugs, and like, but they had like this huge uh, drug presence in their country, and like trafficking and stuff, and like they just basically made it legal to like do a lot of that stuff there or something like that. I mean, I feel like maybe they're just blowing up because their government's letting it blow up, you know?
It could be. I know Bolsonaro has not been the greatest leader at all through his entire presidency. At least the things that I've heard, which isn't that much. I heard he handled the situation with the Amazon rainforest in a way that pretty much solely benefits the corporations. And there was even rumors going around that he kind of was letting the fire burn because as more of the Amazon rainforest burned, it actually opened up more property that could be used for farming and other industrial purposes.
Here we go. I'm just gonna jump in and read a little bit out of this article real quick that I just found. Um, it's just as Brazil's president Jair Bolsonaro was watered has watered down a law requiring the wearing of face masks in public places, even as the number of confirmed coronavirus cases in the country surpassed 1.5 million. The Latin American country has the world's second largest outbreak after the United States. The new virus has now killed more than 61,000 people across Brazil. But Bolsonaro on Friday used his veto power to dilute a law aimed at preventing the spread of the virus. The law mandates masks in public spaces, but the president removed provisions that mandate face coverings in shops and churches. One of the original articles stipulated that masks must be worn in commercial and industrial establishments, religious temples, teaching premises, and also closed places where people are gathering. Bolsonaro, however, alleged that the article was unconstitutional, saying that it was possibly violate the home in referring to closed spaces where businesses and meetings take place. The Chamber of Deputies insisted that this clause referred to places that are accessible to the public, not homes. He also vetoed articles requiring shops and businesses to provide staff with masks and public authorities to distribute masks to people with uh, economically vulnerable people. Congress must now study the president's vetoes and decide whether to maintain or reverse them. So, I mean, that right there tells you that country is falling apart if they're their Congress just can't even agree with their president, and they got vetoes going back and forth. Like, they sound almost like us.
Yeah, it really makes you wonder, like, why would he not want people to wear masks? Because that doesn't necessarily affect the economy. I understand if he doesn't want to shut down because the economy is so fragile that it couldn't handle it. At least that's a valid argument to bring to the table. But the whole thing with masks, you could open up the economy far more if everyone was wearing masks. But the fact that he's going out of his way to make sure that people or to make sure that people aren't required to wear them and that people stay misinformed about them. It's like, is there some sort of benefit to letting the country get hit really hard from this? Is there some sort of ill intent behind it that maybe wants it to be worse there? It's
Well, yeah, and like that's what I was gonna say. Like, it's really strange because it's hard to have like a government, like a Congress or whatever, come together, Parliament, whatever you want to call it, what they have, and come together and vote on something like that and mandate it for the whole freaking country. Like, we haven't done that here at all, and they like pulled it off there, and to have their president just be like, no, like, I'm gonna cut it back. You guys don't have to do all that. That's a little ridiculous. That's alarming right there, because then it's like, don't you want you want like a united country, and once you start pulling that shit, you're like dividing people, and then you have a lot of unrest, and especially when you have so many cases like popping up left and right, like that just almost guarantees there's some sort of ill intent behind it.
Yeah, and maybe it's like Brazil has been becoming a pretty strong country over the past couple of decades, and maybe since I've talked about how maybe this whole virus has something to do with China and them trying to rise to the world's superpower, and maybe part of that plan is to weaken all of these other countries like Brazil. Maybe Bolsonaro is in China's pocket or something, and they're doing everything they can to make sure it spreads more there. And I have an article here about an interesting thing that Sheldon shared with me that kind of adds into this potential China conspiracy theory thing. Let's see. It says here the world's closest known match to the COVID 19 virus was found 7 years ago by Chinese scientists in an abandoned mine where it was linked to deaths caused by a coronavirus type respiratory illness. So, how I would piece together this potential conspiracy theory would be maybe the Chinese ran into this virus several years ago and then stored it, which it actually says later on in the article that they've been holding it at the Wuhan lab. And this is a virus that's very close genetically to the current virus we're dealing with. And we also have heard many things about the gain of function research that's been done at the Wuhan lab, which is basically taking virus and trying to make them more powerful. Maybe they found this, they held on to it, they noticed its potential, they did the gain of function tests on it, they found one that worked, they modified it slightly, and then they let it out. And that was during all the protests that were happening in China. So maybe they kind of crunched some numbers, and they're not allowed to basically go into straight warfare with other countries. Otherwise, they're going to be made as the bad guy, and they're going to have to face our military. But if you wanted to kind of just weaken all other countries in the world that don't take this seriously, like us here in the U.S. especially, this would be a pretty viable route. It seems like China may actually benefit if all of that were to be true. That's just one possible thing. But let me read a little bit more of this article. An investigation by the Sunday Times has found evidence that China has failed to publicly share this crucial information about the sister virus to COVID 19, even though it is the strongest lead in the hunt for the origin of the pandemic. So just more confusing stuff from China, and that's paints them in a bad light is all of the deflection that they've done. The new strain of coronavirus, which was discovered in the mine in 2013, has been stored for years at a virology lab in the Chinese city of Wuhan, where the COVID 19 pandemic started at the end of last year. So really, really sketchy things there. But I do want to talk about the article that you have. Was there anything you wanted to add to this before we go ahead and move to that?
I mean, it's just, I mean, one of those things where we've talked about it all the way, like, since the beginning of the show, just how China is just sketchy, and they're not one of those countries that you could trust their numbers. You can't really trust what they're saying, and they're always going to try to publish, 30 different articles or whatever to confuse the rest of the world, so that way, they're not, the ones to blame, or people aren't sure exactly what to blame on them or exactly where things started, or, it's really just, I feel like with them, like you were saying, it's just kind of a deflection thing. Like they're just try to put it out there and make it seem like, the less information they give, then the less that they knew about it, and therefore that they'll be in the clear. But I mean, the fact that it originated in China, I mean, it had to come from somewhere, and it's definitely a sketchy disease to just pop up and all of a sudden infect, you know, what, 11 million people now.
Yeah, there's quite a bit of evidence pointing toward China right now. So we'll just leave it at that. I don't see evidence for any other thing other than China released it, whether on accident or on purpose. It seems to be all the evidence is kind of slowly gathering and pointing towards that. But I do want to talk about that article that you have about that lady that is experiencing symptoms far after she's been testing negative, and that's something I've heard from a lot of different sources. From Chris Martenson has read some stories, and maybe we'll try and find more and more, because obviously one story doesn't show too much, but maybe we will keep looking for more and more stories and kind of see if we can get a feel for how many people are actually having this same experience of experiencing pretty bad symptoms that may potentially be permanent.
Yeah, and if any listeners, know anybody, or even themselves have, gone through the whole process, like, we want to hear your story. We want to hear how you've recovered, if you have recovered, if they've tested you again. I mean, it's kind of like, really, everybody, the general public, is in the dark when it comes down to, the whole process, and even just a lot of the symptoms, and a lot of the general way that you feel. And, like, I don't know, like, I feel like you just don't get a lot of the firsthand stories. But I'll go ahead and just jump into this article and read a little bit about it. It's just about this woman that basically she's had it for, I guess, months now, and just has not recovered. This was back in May, so I'm not sure. I mean, curious to hear like an update on her story. But anyways, says Kate Porter has had a fever for nearly every day for 50 days. She can't shake the extreme exhaustion that hit when she became infected with the coronavirus nearly 2 months ago. The longevity of her symptoms are unlike anything she's ever experienced. I know it sounds crazy, Porter said, but is this permanent? Um, since her diagnosis, Porter, 35, which I feel like that's something to pay attention to too, as she is a little bit younger, um, has has been in her Beverly, Massachusetts home with her 12-year-old daughter, Adria, who's also had symptoms of COVID-19. Neither of them has had underlying health conditions that would suggest a complicated or drawn-out recovery from the virus, and neither of them has had to be hospitalized. According to the data collected by Johns Hopkins, more than 180,000 people in the U.S. have recovered from the coronavirus, and the Center for Disease Control and Prevention considers a person recovered if 3 days have passed since a fever broke without the assistance of medication, and respiratory symptoms such as cough, shortness of breath have improved. Negative tests can also signal recovery, but tests can be inaccurate. I mean, that's just the way that they've been wording it as well. Just the whole idea of these people that are considered recovered. I mean, I'm gonna keep going back onto that just because I feel like it's something to really like, get into people's heads. Is, if you don't have a fever anymore, like, that's a possibility that they could say you're no longer COVID positive, that you're recovered. You know,
Yeah, just real quick, I think that does that point you keep touching on. It does show kind of the intention behind the CDC and the WHO, because I hear a lot of the theories going around is that they're trying to make it seem like it's worse than it is, that more people are sick than it is. But actually, the way that they're measuring it and the way that they're marking these people off, it actually points towards that they're actually trying to make it seem not as bad as it is. So that's somewhat
Exactly.
of a revealing thing about their intentions.
Hmm. Oh yeah, I mean, it's definitely sketchy, and I mean, that's why I feel like people should more be alarmed and just take it seriously. Like, I mean, it's just like how we discussed before the show. Like, it's not about you taking it seriously personally, but it's about all the people that you're going to be around, and like judging it off of that. You have to base everything you do off of how other people are reacting, and if they're just being stupid about it and irresponsible, then it's going to result in if they get sick and people around them get sick, and if you're one of those people that aren't practicing that precaution, then I mean, it's just this snowball effect where everybody, like, we've already started hearing about parties where everybody starts coming up positive, and really scary after this 4th of July weekend and all these crazy ass celebrations and every single state and everybody getting together, and now it's like kind of like this waiting game, like, okay, so in 2 weeks let's just see who's infected and see who took the precaution actually seriously. So I think you were saying that even you're with your roommate, that it was pretty light, and he or she hasn't gotten her results back yet, right?
They did now, and they're confirmed to not have it.
Well, yeah, but I'm saying beforehand, like
Yeah.
participating in the 4th of July extravaganza, there was still that uncertainty, but it was just very taken very lightly.
Yeah, definitely is. And one interesting thing, because I keep hearing that kind of this second wave explosions started happening over what was that holiday? Was it Labor Day we just had?
Yeah, I think it was Labor Day.
Yeah, whatever that holiday we had like 4 or 5, 6 weeks ago, somewhere around there, and they're kind of pinning this explosion on that because we were seeing lots of reports of people going back to life as normal, and the virus wasn't that heavy back then. So kind of picture this, like let's say only 5% of the people in the United States had it, just as a thought experiment. Then everyone went to those parties and it kind of started off this second wave. Well, let's say now maybe 15% of people have it, and we're pretty much repeating the same thing of doing all these parties. Well, now there's a lot more points of contact in that equation. So, this could, so let's say last time it increased by twofold or something, but now that we're already twofold higher, what if it increases twofold from here?
Maybe
Then it's gonna,
fourfold.
yeah, it's just it has the potential of being pretty bad. And just going through that in my head, I think it's pretty safe to say that we are going to be in for a pretty drastic increase over these coming weeks, and we're probably also going to see the death rate start to catch up. Honestly, yeah, I was pretty worried about this whole virus and the whole beginning, and that worry is kind of softened and softened and softened, and but I keep running into uh, facts like this that I just spoke of, and it's like, wow, is now the time to start stocking up your food storage? Is now the time to start really being careful? Like, who knows? A lot of people kind of feel like we're out of the woods on this, but I would suggest that that's not a safe mindset to have, and that also this is probably how really bad things happen, is to kind of come and then it's like, oh, okay, everything's fine, and then you get hit with it again when you're not focusing on it and you're not prepared for it, and then it really turns into a crisis. So I just want to toss that out there for everyone to consider.
Oh yeah, I mean, it's just like you said. It's gonna with the way that everything is played out. Like, it's gonna hit a point where we didn't do enough, and like, I hate saying that at this point it's probably too late, but it's probably too late.
Yeah, well, I mean, it's never too late to admit to have some effect, but yeah, it's gonna, It's to the point where not enough people are wearing masks, not enough people are taking it serious. There's still so much misinformation going around. And it's really unfortunate because in Europe, it seems like they really might be able to get a hold on this thing and start opening up. So that this is what we've been talking about on this show, is that you can't have this half in, half out approach. Otherwise, you just end up getting a huge second wave, and then you either have to restart or you just have to deal with it. But certain countries that really just did everything right, you can't do 90% of it right. You got to do like 99 out of 100. You got to do those right, and then it stamps it out. Places like Taiwan and New Zealand, I believe, they're some of them are reporting like zero cases. So, you can really shut this down, let the whole thing die out, and then start to go back to normal. But I just don't think that's ever going to happen here in the United States unless it gets extremely bad to where everybody's convinced, no one can deny that it's that bad, and everyone is actually genuinely worried enough that they would follow the strict rules, without even having to be told to. But honestly, let's hope it doesn't get to that. Let's hope that the hospitals don't get overwhelmed, and that we can kind of stay in this targeted closing, and kind of just only close certain places or only back up certain restrictions. No place in the US has actually gone back under lockdown, though I wouldn't be surprised if we see that. Kind of the narrative that I've seen is that from a lot of people was that we shouldn't have locked down, and that we learned from the first lockdown that we didn't actually need to lock down. But I think that is going to really be tested in these coming weeks.
Well, and it's kind of like one of these things that, America's based on freedom and freedom and freedom. And, we have this stubborn outlook as Americans, or, the huge percentage compared to other countries, that we're just like, you can't tell us to cover our face. Like, it's just really like a stubbornness. Like, you see cameras and of like video footage of places like, India, China, and, places in Europe, and, stuff like that. And you have everybody practicing caution. They're all wearing masks. Like, it's just, they go about their day. And it's allowed them to reopen in a safe and responsible manner, and potentially made the United States just this laughing stock, because like, we're just like these people that are like, we're about freedom, and you can't tell us what to do, even if it means, protecting everybody around us. Then it's just like, nah, I'm not going to wear a mask because you want me to.
Yeah, you know what they say, freedom comes with responsibilities, and if you can't manage those responsibilities, then to at some point that freedom is either going to collapse in on itself, or it's going to have to be kind of taken away, like what we're seeing with masks now, where they're starting to actually force states to wear them, which I honestly didn't really think we would see that much. But yeah, we're definitely seeing it now, so that's possible. But I say let's go ahead and close out the show. I want to wish all our listeners a happy 4th of July, even though it's a couple days, we're a day past it now. It'll probably be 2 days past it by the time you hear this. And 4th of July is a time of national pride, and it's Independence Day, and that kind of goes along with what we're talking about. How you have to have your own independence, and that's kind of, you have to be responsible if you're going to have independence. You're not dependent on the government telling you what to do. You can independently figure out the truth for yourself, and that's the blood of America. That's the thing that people love America for, is our independence, and our responsibility that goes along with that. And we've shown as a nation that we have managed those things fairly well. But lately, I would say that we're kind of messing up on that whole thing. And I think one of the most patriotic things you can do in today's day and age is actually question America and scrutinize America, and just question the whole model that we have. And there's some president or something that said, if it's your responsibility as a citizen to basically revolt against corruption even if you're revolting against America, because that's what Americans do. We are willing to scrutinize it, and even if it comes to the point where we're looking at America's mistakes, it's a I think that's really what we need as a nation right now.
Yep. It's just, I mean, like you're saying, it's about being smart and taking those, taking it into your own hands. Like, do a little bit of research and compare things, and you'll come to find that the people that are acting the least radical about anything are usually the people that have the right idea. The people that are out preaching that they're taking away freedoms and stuff like that. Like, that's a little radical. Like, let's talk about it calmly. Like, hey, you should practice social distancing, wear a mask, and personal hygiene. Like you always should, and just take it seriously and live about your life.
Yeah, and if you do decide to do a lot of research for yourself, just know that it is the wild, wild west out there. You really have to have your emotions in check so you can, and really practice your ability to determine what is true and what's not true, what's politically motivated, what's not. This whole virus thing deserves intense scrutiny in and of itself, because there is a lot of potential ways that countries could use this to try and take your freedoms or benefit in one way or another. So yes, definitely scrutinize that, but also scrutinize the denial of it, because there's a lot of incentives for countries and corporations and the whole machine to deny this and to pretend that everything's okay. So there's incentives on both of those things. But what I would recommend people is just look at things on a more global perspective rather than just in the US, because it's much less likely that the entire globe is in on a conspiracy rather than just one particular country. So I think that would be a good place to start. But I want to thank our listeners for checking us out. Remember to give us a like or subscribe. YouTube's not helping us out too much. We're not getting too many views or being spread out there very much. So we very much appreciate anyone who subscribes or comments or just keeps watching our stuff. We really appreciate that. So thanks for tuning in, and it was nice talking with you, CJ.
Yeah, man, definitely. Thanks again for giving a listen, guys, and let's get those likes and follows up there, and let's just start taking this thing seriously.